Sure. I now would like to turn it over to Raquel Mazan-Jeffers from the Community Health Acceleration Partnership, who will be sharing a presentation about maternal mental health equity and the Maternal Mental Health Equity Fund, for which several funders, philanthropies have invested in. She'll be sharing the awardees, I believe, that were announced just last week who've received these dollars. And I think we'll be supporting some of the investments that are necessary to prevent tragic stories like we've just heard now. Raquel, welcome. We're so glad you're here. I'll turn it over to you.
Thank you so much, Joy. And thanks for that moving story. And I do hope that we begin to create through this fund a network of support that will actually be there for families at that very vulnerable moment of early family formation. So hi, everyone. I'm Raquel Mazan-Jeffers, and I co-direct the Community Health Acceleration Partnership, which is a philanthropic organization that is really focused on supporting community-driven care. Next slide, please. And I'm really pleased and proud to have been a part of a group of philanthropic organizations that have come together to form the Maternal Mental Health Equity Fund, which is a nationally focused pooled fund that is working to directly address the mental health and well-being of BIPOC families in the community. As many of you already know, in 2021, mental health was the leading preventable cause of maternal mortality and affecting 1 in 7 birthing women and nearly 1 in 4 new mothers of color. It intersects with many societal issues, including child development, housing, family economic security. And unfortunately, most pregnant and parenting people of color are not getting the help they need. So this fund will invest in a cohort of organizations from within communities and across the country who are delivering models of care that were built in and by communities themselves. The pool fund will provide both financial support directly to community-rooted and led organizations for at least 3 years. And then we will also be supplementing those investments with targeted grants for learning, evaluation, technical assistance, and also connection to policy partners and evaluation. These two strategies together, the on-the-ground support and the larger policy and capacity building investments, will help to elevate these community level interventions and innovations so that they could be in a position for larger statewide and national policy and financing systems. So our ultimate goal is really to aggregate up to a larger systems change, but have that change be led by the people on the ground who are closest to the community members. So a group of funders came together in December 2022 to lay out a vision for the pooled fund, and we launched a national RFP, which was focused on funding for 501c3 organizations that had an annual operating budget of between $250,000 and $1 million. And priority applicants were we gave priority for applicants who had culturally relevant direct maternal health services in BIPOC communities. The organizations needed to be rooted within the communities they served, and the applicants needed to have some experience or interest in influencing systems change. Next slide, please. This is the list of the current philanthropic groups that are part of the pooled fund. It includes the Perigee Fund, the Moritz Family Foundation, the Irving Harris Foundation, the Roots and Wings Foundation, Awara Mendi Adeagbo, who is an independent donor, and some other anonymous donors and investors. Next slide, please. And really, our theory of change is that at the end of 3 to 5 years, if we invest in a network of BIPOC-led communities, both in terms of their actual funding for their organization and their capacity and their ability to document their impact, then these organizations will help shift the systems and really redirect sustainable financing to community-rooted and led organizations that are having a tremendous impact in the communities that they're serving, but they have really been historically underinvested in. But they do bring the trust and cultural congruence that is necessary for really addressing issues as intimate as maternal mental health issues. Next slide, please. So I'm really pleased to announce these are the first 7 organizations. We received 150 applicants. We are funding 7 organizations at $75,000 a year for 3 years. We have really focused on making sure that there's innovation in service delivery, that there's a diversity of model platforms and modalities around maternal mental health. There are some organizations that have a very specific evidence-based approach to addressing maternal mental health, and there are some organizations that are providing more of a core support to families to really just make sure that they have the support they need before even the mental health issues begin to escalate to really complicated places. We tried to make sure we had a geographic distribution. All of the organizations have expressed an opportunity for systems and policy change, and we really also looked for an overall fit within the learning community, since there will be a lot of peer-to-peer learning among them. And as I said, we are also layering in some technical capacity support for them, as well as opportunities for evaluation, measurement, and policy change. That's it.
Well, so exciting. And congratulations to these 7 organizations. I'm sure we can read more about them on your website. And if there's a link you want to drop into chat, Raquel, we would love to dig into those sites more. And I'm actually excited to share that one of the awardees is actually on our next panel. So we'll get to hear from her, A Village of Healing, in just a moment. Thank you so much, Raquel. And I also just want to acknowledge, I know others are probably thinking about all of the other, 150 organizations, or what is it, 48? No, not one. I'm not a mathematician here. The remaining organizations that are going to need some financial support. So it's so exciting to hear from organizations like Mindful Philanthropy and others who hopefully will be able to come in and support those organizations. We're going to do our best to make sure that they're supported here at the Policy Center as well. Thank you, Raquel, for your leadership, and to the funders of the fund. We appreciate it.
Thank you, Joy.